Hi, my name is Sophia. I'll be your nurse today. I'm going to be doing a head-to-toe assessment on you, just assessing all of the major organs, asking a couple questions, obtaining some vitals. If you have any questions along the way as well, you are free to ask. I'm going to pull this curtain for some privacy. I'm going to wash my hands, and I'm also going to wash my stethoscope. Would you mind confirming your name and date of birth for me?
Ty Gonzalez, 52601.
Thank you so much. I am first going to start with your vitals, starting with your blood pressure. I'm going to be doing the two-step method. I'm going to pump it up to what is believed to be your systolic, and then I'm going to go 20 over that to obtain your blood pressure. Okay, patient's systolic is noted at 128. Okay, patient's blood pressure is 126 over 82. While I was grabbing the systolic, I counted respirations for 30 seconds and multiplied by 2 to get 17 beats per minute. I'm going to put a pulse oximetry reader on you while I get your temperature. 97.6. Oxygen is at 99% and heart rate is at 74. Next, I'm going to get your pulses here. Okay, pulses are +2 bilaterally, and I'm also going to check your capillary refill here. Okay, capillary refill is 2 on the upper extremities bilaterally as well, and pulses were bilaterally as well. Next, I'm just going to ask you a couple questions. Do you know where you're at today?
The hospital.
Okay, do you know why you're here?
For my pain.
And what day of the week is it?
Thursday.
And who is the president?
Joe Biden.
Okay, next I'm just going to have you stare at my nose. Okay, pupils exhibit perla. Patient is alert and oriented ×4, and speech is clear and recognizable. Up next, I am going to start with your, are you experiencing any pain today?
Yes, I am.
Okay, and on a scale of 0 to 10, 0 being no pain, 10 being the worst pain imaginable, what is your pain at right now?
About a 6.
Okay, and what is the tolerable pain level on that same scale for you?
Probably 3.
Okay, and what are some characteristics of this pain? Is it sharp, dull, achy?
It's pretty sharp, I would say.
Okay, and when did this pain start?
Last week.
And where is this pain at?
My head.
Okay, and when this pain comes on, does it last throughout the day? Does it come and go?
It comes and goes.
Okay, and does anything make it worse?
Bright lights.
Okay, does anything make it better?
Resting.
Okay, and does this pain radiate anywhere, or is it pretty localized?
It's pretty localized.
And are you experiencing a cough at all?
Yes.
Okay, is it a productive cough? Does anything come up?
Yes.
What is the color of it?
Green.
And the consistency?
It's pretty runny.
Is there an odor to it at all?
No.
Okay, and does this cough continue throughout the day, or does it come and go?
It's pretty consistent throughout the day.
Does it bother you at all?
A little bit.
Okay, got it. Up next, I am going to start by opening up your gown and looking at your chest. Okay, patient's skin is dry, warm, and intact. No bruising, wounds, or scars are noted, and color is appropriate for race. Precordium looks typical. Next, I'm going to listen to your heart sounds, and I am going to listen with the big side and the small side, so diaphragm and valve, starting with the big side. Aortic, pulmonic, herbs, tricuspid, and mitral. All right, flipping it over to the valve, doing the same thing, mitral, mitral, something, herbs, tricuspid, and I'm sorry, it goes aortic, pulmonic, herbs, tricuspid, and mitral. Done on the diaphragm and the bell side. Rate and rhythm is even, S1 and S2 are heard. Next, I'm going to listen to your lung sounds, doing 6 on the front, 6 on the back, and every time I place my stethoscope, if you could just take a deep breath in and out for me. Right. Lungs are clear on the anterior side bilaterally. If I could have you sit up for me as well. All right, first I'm going to check the skin on the back. All right, skin is warm, dry, and intact. Color is appropriate for race. No wounds, bruising, or scars are noted. There's also no pressure wounds or bruising on the hips bilaterally as well as the coccyx. All right, and we're gonna do the same thing again with the 6 placements. All right. On the posterior side, thoracic expansion is even. The lungs are clear bilaterally on the posterior side as well. So next, I am going to assess your upper extremities, starting with just looking at the skin. Okay, skin is dry, warm, and intact. No wounds, bruising, or scars are noted, and color is appropriate for race. Do you notice any numbness or tingling in your legs or your arms?
No.
Okay, and do you notice any swelling in your legs or your arms?
No.
Okay. Next, I'm going to have you move your wrists. Okay, patient has good mobility of the upper extremities bilaterally. I could have you go like this. Okay, patient has good flexion and extension of the upper extremities bilaterally. I'll have you squeeze my fingers. Patient has good grip of the upper extremities bilaterally as well and is strong. Okay, next I am going to move on and I'm going to ask you a couple questions about your bowels. When was your last bowel movement?
This morning.
Okay, and what was the consistency?
It was pretty solid.
And the color?
Brown.
Okay, and would you say you frequently have bowel movements?
Yes.
Okay, and is your frequency, shape, and size, is that pretty consistent as well?
Yes.
Okay, next I'm just going to take a listen to your abdomen in 4 quadrants. Active bowel sounds are heard in all 4 quadrants. Next, I'm just going to feel. Okay, no masses are felt upon palpation of the abdomen. So next, I'm just going to move on to how many times would you say a day that you urinate?
Probably 6.
Okay, and what is the color?
Pale yellow.
And is it clear, cloudy?
Clear.
Okay. And is there a specific odor to it, or is it, no? Okay. And when you are urinating, would you say that your output is pretty adequate for your intake?
Yes.
Does it hurt to void at all?
No.
Okay. Patient voids without difficulty. And do you feel like you get it all out of you, or are you still holding on to some of it afterwards?
Feels like I got it all.
Okay, amazing. So next, I'm just going to move on to your lower extremities. You said no numbing, tingling, or swelling, correct?
Correct.
Okay, no edema is noted bilaterally in the patient's lower extremities. Next, I'm just gonna push on your calves here. Does that hurt at all?
No.
Okay, no lower extremity tenderness noted bilaterally as well. So next, I'm going to have you push down like you are driving a car. Okay, and up. Okay, patient has good flexion and extension of the lower extremities bilaterally. I'll have you move them around and wiggle your toes. Patient has good mobility of the lower extremities bilaterally as well. I'm gonna check your heels here. Okay, heels are intact bilaterally as well. And then I'm gonna do pulses. Okay, post-tibial pulse is +2 bilaterally. Medial pulse is +2 bilaterally as well. All right, and then I'm gonna wash my hands here. All right, and then I'm just gonna feel your abdomen one more time. Abdomen is soft, round, and non-tender as well. So here is your call light for you. I'm gonna lower your bed for you. One other question I did have, you said no gas or bloating, correct? Okay, perfect. That is lowered. Call light, do you have any other questions for me?
No.
Okay, perfect. If you need anything, just let me know. I'm gonna wash my hands here at the end, and I'm also gonna clean off my stethoscope. And I hope you have a good day.
Thank you.